So a viewer from Brainerd wants to know, this viewer is specifically wondering what the Republican Party position or led caucus position is on the provider tax. Of course, there's a larger question about what we're going to do, if anything, about the fact that the provider tax goes away, I think, at the end of this year. So let's start with you, since the question's more or less directed at your caucus. Is there a position on reinstating the provider tax or any related questions on that issue?
Yes, very definitely there's a position, and we believe that the provider tax should go away, as it's been agreed to let it fade away. It's just adds to the cost for everyone's health care. Everyone who gets any kind of health service that's subject to this provider tax, it's coming out of consumers' pockets. It's adding to the cost of health care. We agreed to get rid of it. It needs to go away. We have problems in health care that need to be addressed, but the provider tax is not the way to address them.
So the provider tax, for viewers who might not know, a number of years ago was determined as a way we were going to pay for health care. Always had a certain amount of controversy around it. And when we put that sunset date that it was going to go away, we didn't have any plan for how we were going to replace it. Here's the impact it has on, again, that kind of phony surplus. 1.5 billion surplus. If that goes away, we add another $600 to $700 million problem. We deduct that from that projected surplus. That's the gap left as we try to write a budget again. So you can't just have a tax go away with no plan for, okay, then how are we going to pay for health care now? If that's the way we paid for it, then once it goes away, how are we going to pay for health care now? And we don't have a plan for that.
I agree. I've always said absolutely we can get rid of the provider tax. By the way, everyone says we're the only state. We're not the only state that has something like this. We're one of a number of states. But I've always said to the interests who come in who want to get rid of it, that's fine. But it's not like we can't can't just do away with the things that it pays for. Critical access health care, the public health care insurance plan, Minnesota Care. The governor has built into his budget some ability to address prescription drug costs, as well as the individual premiums, which have become very expensive on the healthcare exchange. We have this kind of premium buy down, and the Healthcare Access Fund is a source to help with those premium offsets, as well as some reimbursements for folks who do experience extraordinary premium increases. So it's not like we can do without those things. So we find a replacement that makes sense, sure, but I haven't yet seen that.
Any other thoughts on the provider tax?
Well, you don't lower the cost of health care by raising the cost of health care. We need to find ways to lower the cost of health care and the cost of health insurance. Some people are paying, as you said, exorbitant rates of health insurance. We've had some success with reinsurance. It's actually had a positive effect, and because of the waivers that are in place with the federal government, it's not costing us that much. Apparently the governor thinks it's a bad idea, so we'll see how that all plays out.
Well, I have to disagree. When people go without health care, that drives up health care costs for all of us.
For everyone.
That means people are getting sicker, and they're driving costs in our hospitals by accessing their primary health care and they're not reimbursed, not bringing reimbursements with them through our emergency rooms.
So with respect to the viewer's question about the provider tax, do I understand the governor's position that tax should be continued?
Yes. Yes.
That's the budget calls for that, correct?
Mm-hmm.
So, and that's going to be one of the topics that's going to get discussed and in some measure voted upon eventually by the House and Senate.
And the reason it would be unpopular, apparently, for the Republican Party, if it's sunset and then you restore it, that would be perceived as you're raising taxes, and it's the messaging of that would make a.
Well, it's a tax. It's adding to the cost of health care.